Thank you for joining us for Application Assistance with Benefits in Action with Rachel Wise, Manager of Marketing and Outreach at Benefits in Action. My name is Christy Moran. My pronouns are she and Aya, and I am the Adult Library Services Senior Consultant for the Colorado State Library, or as I like to say, a librarian for you, who are Colorado's librarians and library staff. Today's event will be and is being recorded, and all registrants will receive an email with a link to the recording and any resources shared. At the end of the session and in the follow-up email, you'll get those, and you'll also get a link to a survey. The State Library uses this survey to inform our work and to report on the value of our programming. I should say that today, literally today, more than ever, more than any other day, your responses to those surveys really do tell a story about what it is that you value and how it is that you value our work. So we will be checking chat throughout. Rachel will leave leave time for questions at the end. And at that time, you're either free to chime in with your voice, or we will be reading your questions aloud from the chat so that we'll be able to catch the question on the recording for all of those who are viewing later. So now, without further ado, I'm going to turn it over to our facilitator, our presenter, Rachel Wise. Go ahead, Rachel.
Thanks, Christy. Hey, everybody. So my name is Rachel Wise. I am the Manager of Marketing and Communication here at Benefits in Action. I'm going to try to share my screen now and keep talking at the same time. Let's see if I can do that. I just want to say we serve people statewide, and we really do appreciate our partnerships with libraries across the state and all of the resources and education that you provide to folks. I'm formerly a public school teacher, so I really, really appreciate these kind of community resources. So thank you for what you do. And let me see if I can find my button. It's kind of hidden under this little Zoom bar at the top. Sorry, friends. Can I just go into presentation mode? Well, this is going to be fun. Hang tight. We're almost there. We're like so close. There we go. Okay. So hi, I'm Rachel Wise. I'm the Manager of Marketing and Communication here at Benefits in Action.
Rachel, there you are.
There I am.
You're there. Got it.
Super. Okay, thank you. So we are a Colorado nonprofit, I'd mentioned, and we serve people statewide. So today I'm going to share a little bit with you about who we are, who we serve, how we do that, and the next steps for reaching us. And as Christy said, feel free to, share some questions in the chat, and we'll get to all of that stuff at the end. I do want to mention again, this is the first in a series of presentations that we'll be sharing with you all. Up next, I believe we have a Medicare 101 presentation and then a Social Security 101. So just a disclaimer, I'm more of a generalist and cheerleader for the experts back at our office who will share a little more in depth with you at a later date. So here's some of our lovely team, certainly not all of them. We have an office in Lakewood, Colorado, but we also serve people through Adams County Human Services, Jefferson County Human Services, and DPS schools in Boulder County. We've got a Colorado Springs office. So we really are trying to expand kind of our physical footprint across the state. But wherever you are in Colorado, you can reach out to Benefits in Action by telephone, and we can assist you kind of with those range of benefits needs that we'll get into in just a moment. So we are a nonprofit really just dedicated to connecting our diverse community with support and resources that they need to thrive. We recognize that that's different for everybody. So we are a HIPAA compliant organization. All of our staff and volunteers statewide are HIPAA certified on an annual basis. And then we do hold kind of regular HIPAA case studies and questions during regular staff meetings, just to be sure that everyone is aware of their responsibility to our clients' personal information. So the work that we do at Benefits in Action can kind of be broken down into these three pieces of application assistance, which really is the large piece that I think people mostly come to us for. And that looks like sitting down one-on-one with a benefit navigator and working through a particular application, be that for food assistance, disability, and a whole range of programs, where we actually help complete that application on that person's behalf, make sure that all the required documentation is appropriately submitted, just really to ensure that highest likelihood of success. So we'll see a list of programs we can help with. And then we really help people as well to kind of navigate those programs, better understand what coverages are available, limitations to those programs, and really just get the most out of them. I come to think of things like Double Up Food Bucks, for example, which can help people to stretch their SNAP dollars a little bit further, or recognizing sometimes that people have dental coverage that they don't even know that they have. And then we also provide education kind of in these group settings, virtually, in person, both general as well as like special topics, Medicare, Connect for Health Colorado, Social Security, and a lot more. Just really whatever our community is requesting of us, we're happy to try to bring that to you. So please do feel free to reach out to me and let us know if you have other needs as well. With our goal really to improve benefit literacy, understanding, and utilization throughout the state. Please ignore my oddly numbered slides. I tend to have several in this deck, so you might see we skipped to 34 in a minute, but we'll stick with this. So once again, I just included this as well. We're a nonprofit. We can help people, I'd like to say specifically with their health insurance. You'll notice things like Medicaid. That also includes Medicaid waivers, so things that help people to live independently in their homes longer, provide those home and community-based services to folks, as well as like long-term care, and Medicaid based on your income, and Medicaid that helps pay for your Medicare out-of-pocket expenses. And we're part of SHIP as well, which is the Medicare State Health Insurance Assistance Program. So we serve folks statewide as well, helping them just better utilize their Medicare. We help with Connect for Health, which is the state healthcare marketplace for those looking to purchase their insurance. So we really want to be a one-stop shop for you and the people that you serve, kind of regardless of where they are in life, what kind of recent life changes they may have gone through, their age, their income. So certainly feel free to refer to us for all of those needs and so much more. So I tried to make this prettier. This is my wordiest slide, I think. So this is kind of the range of programs that we assist with here at Benefits in Action. Not an exhaustive list, things do change, but we are always continuing to grow to meet people where they are. So for that healthcare column, I've kind of already shared with you that Medicare, Medicaid, and Connect.
Hi all. I have Rachel cut off an audio. Does everyone else have that as well, or is something wrong with my computer? I just want to be sure.
Hello,
Okay. Rachel, are you there?
I am. Can you hear
Okay.
me?
All right, you're back. All right, I'm gonna let
Oh
you keep
no.
going.
It says my connection is unstable, so let's hope we make it. Let me just drop that in the chat. Can you all hear me?
Yes, we can. Can you hear us?
Okay,
Okay,
I
great.
can. Okay, so hopefully my connection will last. If not, I'll see you again in just a moment. So we can assist with healthcare programs kind of across the board, programs that help save money for older adults on out-of-pocket expenses with their Medicare. And we also have a Social Security certified non-attorney representative on our team who will be sharing with you here in a few weeks, just kind of general information about Social Security and how to reach them as well. Beyond that, we help people to recognize when they may qualify for food assistance through SNAP and apply for that benefit. as well as we do some food delivery in the Denver metro area. So if you are in Adams, Arapahoe, Denver, or Jefferson counties, we do have some zip codes that we are able to serve there for folks who are homebound and struggling to get out and access food resources, kind of for a number of reasons, be that mobility, distance, illness, you name it, we can try to get that food box to their doorstep. We also help with pantry referrals, so just helping folks to recognize those resources where available. And then you may recognize some of these over here on this right-hand side as well. So heating assistance is LEAP. That's the Low Income Heating and Energy Assistance Program. That wraps up here at the end of April. So that helps to cover some of those winter heating costs, and it runs seasonally. So November 1 through April 30th. And it can also help with like furnace repairs and that kind of thing as well. And we try to also be aware of kind of regional programs that may supplement things like LEAP as well. Do I still have audio? Are we good?
You do. Keep going.
Awesome. Okay. So our dental grant for those 60 and over is for low-income seniors and helps to cover some dental procedures like x-rays, relines, extractions, and more. So folks come to us, apply for that grant, and then we set them up with a dental provider who renders those services under that grant. So typically that's folks that have no dental insurance or maybe have exhausted a Medicare Advantage plan as well. So reach out if you know anyone that could qualify. We help with cash assistance programs, RTD Live, which is a discounted program for public transportation that folks can qualify for if they're not a youth or older adult. And we were just wrapping up actually our tax program this past weekend. So we've helped over 600 Coloradans get free state and federal tax returns completed, as well as tax credits. And that was through the VITA program. So that's the Volunteer Income Tax Assistance Program. And there are about 40 sites, I believe, statewide that do that service. So that's a really great one we like to share, especially in years where there may be TABOR refunds as well. And lower income individuals may not access that otherwise. So yeah, lots of great programs. And again, we can screen people for benefits. So if someone's not sure about what programs they may qualify for or have no idea what's even out there, they should just definitely call us, anyone in the state of Colorado of any age, and we can screen them and see what they qualify for and then help them get that application in. Mental wellness has been a little bit on pause. We do some connectedness calls to folks who are feeling socially isolated with the help of great volunteers. And let me just put out a pitch to volunteers. If you're ever needing an organization to spend some time with, we have lots of remote and in-person opportunities, and we love and welcome you. So those folks connect with that volunteer on a weekly or bi-weekly basis, and just really do a social check-in. It's a friendly conversation, and oftentimes can refer people back for other services when a volunteer discovers that need. So we love that program. There's more to come from our mental wellness too, so stay tuned and visit our website. We also put out a bi-weekly newsletter, so yeah, more to come there. So I'd mentioned we're part of SHIP. Again, that's the Health Insurance Assistance Program. If you are serving older adults, certainly during between October and December, they are getting slammed with all kinds of information about Medicare plans. They're getting calls from brokers, agents, things in their mail, things on TV, and it's really hard to know what's what. I'm unstable again, I think.
We hear you just fine, and we see your
Perfect.
slides just fine.
Super. So we are one of a number of state health insurance assistance program sites throughout the state, providing that free and unbiased Medicare counseling, just so people can kind of know what's what, help them make decisions based on, their needs and the education that we're able to help provide. And we are not affiliated with insurance companies, so they can certainly know that when they come to us or another SHIP site, based on their county, that they are getting free and unbiased help and not being sold anything. So more to come back for our Medicare 101 presentation where you'll hear from Karen a little bit more about the depths of that. Super. So we have on our website a referrals page. This link is a little shorter than what it used to be, but we also receive referrals through findhelp.org. If you're on there, you can kind of see a back end there, as well as Unite Us, which is a closed loop referral system we utilize. But this system's a little bit shorter where the form may change over time, but it's a quick way for you to just share some information for us to reach out to someone and get them scheduled for an appointment with one of our navigators. It's also the same form that lives on the home page. So folks can click that Get a Schedule Now button and just drop in a few quick details. And so they'll go into our database for a quick callback within a couple days. So certainly feel free to utilize that. And we encourage anyone to make a referral. All right. So Benefits in Action really relies on social determinants of health as we grow our programs. We really originated out of the need for help navigating Medicare and finding affordable prescription drugs. And as you see, we have grown to encompass a range of health insurance programs, food assistance, cash assistance programs, and just a number of other state and federal resources. And really, we try to bring those to people where they are. So by providing that telephonic assistance, bringing food to your doorstep if you're one of those homebound neighbors in those 4 counties, providing a range of languages. We're really trying to reach folks and recognizing that things like genetics, physical environment, the kinds of food resources and healthcare resources in your community are not equal. So trying to overcome those barriers for folks statewide. So this pyramid of client support is based on an older adult, and I think my numbers may need a little updating. But based on this range of programs, if someone were to qualify for the low-income subsidy for Part D prescription drugs on Medicare, a program called an MSP, a Medicare Savings Program that covers Part B premiums and some other costs, SSI, food assistance, that heating assistance, and Medicaid, this could average out to like $18,000 annually for an individual in benefits. And we recognize that that might not be cash in your pocket, but it certainly is a little bit more choice when you're at the grocery store and the opportunity to live independently longer in the home of your choice, among other things. All right. Here's another great plug for our volunteers. So we serve, well, we're welcome to have about 100+ volunteers every year serve us, from like individuals and families to social clubs and corporate groups. Folks come into our food warehouse and pack, and as well as go out and deliver food in the community. We also welcome benefit navigators. A number of our Medicare ship counselors are actually retired volunteers, enjoying their best life, living. We've got one friend that goes from Colorado Springs to Chicago a couple times a year, back and forth, but they find a few hours in their week to serve their community and help folks to navigate these programs. So there are a lot of ways to get connected. Again, Connectedness Calling is a remote opportunity, so wherever you are, you can help with that. So we welcome you. Please check out our website or reach out to me if you have more questions. Oh, also, I do want to mention, if you are someone in your community or know someone in your community who's interested in helping volunteer, for example, do Medicare counseling, that would certainly be an awesome opportunity we could talk about. I'll plug that specifically. So now I welcome questions. Please let us know what you're seeing in your communities, how we can best be of service to you. We certainly want to make sure that, you know, we're hearing folks and reaching out. All right, and here's my information. We'll just leave this slide up for a while as well. Let's see. Let's see if there's anything in the chat.
So I don't see any questions in the chat
Yeah.
yet. But I do want to invite, at this point that Rachel has taken kind of a pause, I do want to invite questions. And remember, Rachel is a generalist, but she can take some of your questions if they are more pointed, to be able to let our future presenters on Medicare and Social Security know as well. So Courtney does have a question in the chat. I'm going to read it out loud. Hopefully my voice doesn't impede its recording and impact. Do your navigators or other staff do in-person presentations or programs? And Courtney, I want to clarify, in-person presentations or programs for the public. In other words, a library inviting Benefits in Action. Correct. Will Benefits in Action have a program perhaps in person at a library to that we can invite the public to?
So yes, we do provide those where available, and we can certainly discuss. We'll have to check and see who we have kind of in your area, but we're more than open to that. We love that.
Thank you. That's really important for a lot of our libraries,
Yes.
especially because you guys are the ones who are a resource, and we are so over capacity quite a few times, quite often. Any other questions in the chat? I do see that there are folks really from all over the state, from most all over the state. So I want to make sure that we're getting questions and are able to provide answers for anyone, regardless of where you are.
Yeah, so I'll just share again that Benefits in Action, I like to say there's something for everybody. Again, we serve people statewide with things like food assistance, disability, healthcare programs, just a wide range of state and federal benefits. So even if we are not physically located in your backyard in this vast state of Colorado, we certainly can be reached. And please do feel free to reach out to me there personally as well. And I'll see what questions I can get answered. We do have a Medicare session coming up with Christy, as well as a Social Security, and we are open to other requests as well if there are other program specifics.
Yes, please let me know. If you are interested in very specific programs at your library, please reach out to me. You know how to reach out to me. So we have two questions. I'm going to take one from Evelyn first. Do you, as in Benefits in Action, provide assistance in languages other than English? So it could be Spanish, but it could be other languages. Do you provide that assistance in those languages?
We do. So we do have a number of Spanish speakers on our team, as well as a few other languages represented on our staff. And we do also utilize like a live interpretation service that we can use to access a range of languages, so that folks can utilize services in the language of their choice.
Thank you so much. It's very important. As several of the folks on our
Yes.
call right now represent libraries that have quite a few multilingual community members. Another question, do your enrollment assisters do in-person or virtual appointments with individuals or both?
Sure. So we do both. I do want to clarify as we're benefit navigators, so we don't technically enroll anyone. That does happen at the county level, but we can apply for benefits and help folks to navigate those both in person and virtually. I will say that while we are working to expand our physical footprint, like I mentioned, we may not quite be in your backyard yet. So there are some options for folks. And for example, like Connect for Health Colorado has an identification requirement. So when we do help people with that, that's either in person or by Zoom. So wherever you are, we can be reached. And we do actually have a toll-free number as well. I'm not sure if I've got it on here right now. I don't. Let me drop that in the chat.
Thank you. I think one of the biggest, this has always been my experience, one of the biggest challenges that we have in libraries is that folks come up to us asking us questions that we know we cannot answer. And really resource navigation is like the key, right? And so that toll-free number is going to be very, very useful for us. Now, I have a question to kind of piggyback on Courtney's question, which was the virtual or in-person assistance. Is it possible to do virtual assistance by appointment, or is it just kind of first come, first serve? And I ask that because there are opportunities, I think, in some of our libraries to perhaps host an appointment kind of clinic. I hate to use that word, but office hours seems also a little weird, to have folks maybe come in, line up, and do benefits navigation. Is that something that Benefits in Action can do? Say, set up like 3 hours for Alamosa Library, virtual hours.
I think there's certainly potential for that. So, where we have capacity and navigators on the ground, we certainly do work to try to co-locate and meet people where they are, at their libraries, their schools, etc. So that's certainly an option. Typically, I'd say we do work by appointment. So, we do encourage folks to reach out to us, a little bit ahead of like a recertification date or something if they know that they have that, because we do receive a high volume of calls, and it can fluctuate throughout the year. For example, Medicare open enrollment, we certainly get a lot of calls during that time. But yeah, we can schedule in person or virtually, by appointment ahead of time as well.
I love that. Thank you very much. Now there's a question. It's like a two-part question. I think they're pretty related in the chat. Before I ask it, please check the chat for Rachel's entry of the toll-free number. And I want to read it aloud for anyone who didn't catch that, who is only viewing the recording. So the toll-free benefits and action number is 1-888-496-4252. Now, to Emily's questions, what information is helpful for us, so again, frontline library staff, to share with potential clients? Are there trends or common questions or confusions that we can help clear up before referring someone?
Certainly. So, I think if people have questions about any state or federal benefits, things that are food, health, financial related specifically, for example, like housing is not really our strong suit. We'd certainly refer to that appropriate organization. I would say to have them call us. We do also maintain, strong relationships with community partners. So if it's not us, oftentimes we can tell them who they should call. But anyone can reach out. Additionally, I think one of the main misconceptions is, a lot of folks sometimes call us thinking we are the county, or sometimes county may transfer them to us and not share that it's us. So while we do have extensive knowledge of the various programs and we can help you apply, troubleshoot, um, you know, renew those benefits, make sure that those applications get submitted correctly the first time. We are not the county, so we cannot approve those benefits. And I think, sometimes that's a bit of a pitch point. So, all right.
And we have another question. Does Benefits in Action have printable flyers available to download? Putting flyers in hands is one of the best ways for library staff to get the word out. And that is absolutely something that many have shared with us. So if you have any PDFs or something that people can download, is that something that you have that we can share out?
I can certainly share those to you. I don't know that we have any of them available for download on our website, but we could share that to you if there is like a specific, if you'd like a large poster, for example, that says, "Do you need help with this range of benefits? Call Benefits in Action." We're more than happy to create that for you and send that over, kind of in whatever size you'd prefer. We do have kind of our general, we do like a bilingual double-sided postcard that just has a short list of programs and says and more, that I'm more than happy to send that, and some other things right off.
Okay, so Rachel, you just said something that me as the state library, for as long as we will be a state library, is very interested in, as many of the folks on this call know. I get stuff and reroute it to libraries all the time. Spoiler, FYI, you guys are all going to get Alzheimer's Association stuff coming really soon. So please, let's have that conversation. Additionally, if you individually and independently in your libraries want to reach out to Rachel, please go ahead and do that, since it might not happen from the state library side. That said, I also went ahead and put in the chat a link to 211 Colorado. So that is 211, like the numbers, 211colorado.org. Rachel mentioned that something like housing and perhaps some services as opposed to benefits, maybe outside, just a little bit outside of benefits and actions, kind of like area of concern, real strong suit. So 211 Colorado is a dashboard. You could literally call 211, but also if you just 211colorado.org on a website, you can walk someone through finding an appropriate resource. Rachel also put in the chat findhelp.org. So that is FINDHELP.org. HELP.org. Benefits in Action receives referrals here, and there are resources by zip code as well. So it's excellent. Thank you very much. And also remember My Friend Ben, which has a name that is really complicated, but it's My Friend Ben, as in benefits, is a tool that is used in Colorado. We're very fortunate to have it. So now,
Yeah.
any other questions? Rest assured, these slides and any resources that Rachel chairs, including links, I will be able to pass along to you. If if Benefits in Action ends up doing PDFs that we can send along, I will upload them into a blog post and get them to everybody. I suspect a lot of us are going to be getting a lot more questions about benefits and services available to our community members very soon and in a high number. So we still have time with Rachel. Anyone have any comments, concerns, maybe a situation that you'd like to share and you'd like us to run through how Benefits in Action would be able to help you in that situation? Oh, I do want to ask, the toll-free number, will there be Spanish speakers or other language speakers available at that number, or the live interpretation only for programs?
So both of those numbers, our local number and the 888, feed in directly to our intake team. So the same services should be available at both, just expanding that option for folks. And I'll mention a couple of things here. You do see there at the top, there's my direct information. Again, I'm the manager of marketing communications, and I do some outreach work as well. So feel free to contact me about anything, any questions, marketing stuff, flyers, and I'll share those things as well, events related stuff. And then beneath that, I've got our local number. Again, we've shared in the chat the toll-free line as well, which is again 888 496 4252 if folks prefer that. But they can certainly also reach us there at the 221-8354. We've got some helpful links down there for sending referrals in. We've also got our food delivery. Again, that serves 4 metro counties. That's Denver, Jeffco, Adams, and Arapahoe. And then I highly encourage you to sign up for our Benefits Beacon e-newsletter. We put that out twice a month, and it contains important program updates, helpful tips, deadlines. So those things are really good to have at your fingertips as well.
Excellent. And I imagine that the Benefits Beacon newsletter is appropriate for the public. In other words, if our libraries were to share resources with their community members, that might be something of interest, particularly to our communities now, correct?
Absolutely. Absolutely.
Wonderful.
Yeah, so lots of information about Medicare scams, for example, EBT scams, new program updates, when you should call about your Medicare and make those changes, all kinds of really important stuff. So please sign up for the Benefits Beacon
Thank
and
you.
share widely. Thank you.
I'm going to leave a few more minutes for anyone to ask questions. I know sometimes it'll take a bit, and remember, please, and I'll put the link again in the chat for the upcoming webinars, including one that's not from Benefits in Action on diabetes education. That's available for your community members too. Does anyone have any other questions that we can ask Rachel while we're here and we can capture on the recording? I wish I could see the little like people typing, you know what I mean? Because I don't want to end it too soon. But that's
So
okay. I'm going to go ahead and end our recording now. And of course, anybody, if you have any questions after this webinar, or even like as soon as I stop the recording, please feel free to reach out and ask.